Recording voiced by Ivona.com. The Old Operating Theatre Museum is the oldest surviving operating theatre in Europe, dated from 1822, and used in the days before anesthetics and antiseptic surgery. The museum is located in the herb garret of St. Thomas's Church, Southwark, on the original site of St. Thomas Hospital. In the early 19th century, all operations at St. Thomas's took place on the ward. In 1822, part of the hospital's garret was converted into a purpose-built operating theatre. 40 years later, in 1862, the hospital moved to its present site at Lambeth, and the operating theatre was closed. The theatre lay undiscovered until 1957, and it was only then converted into the Old Operating Theatre Museum. The patients treated here were all women, mainly poor, who were expected to contribute to their care only if they could afford it. In those days, rich patients were treated and operated on at home, most likely on the kitchen table, rather than in hospital. Until 1847, surgeons had no recourse to anesthetics. They depended on swift technique and alcohol or opiates to dull the patient's senses. Surgeons could perform an amputation in a minute or less. The operating theatre had closed down before antiseptic surgery was invented. The majority of cases were for amputations or superficial complaints, as without antiseptic conditions, it was too dangerous to do internal operations. Patients at the Old Operating Theatre had to put up with a student audience to their distress, because they received medical treatment from some of the best surgeons in the land, which otherwise they could not afford. The risk of death at the hands of a surgeon was greatly increased by the lack of understanding of the causes of infection. Although cleanliness was a moral virtue, descriptions suggest that a surgeon was as likely to wash his hands after an operation as before. The old frock coats worn by surgeons during operations were, according to a contemporary, stiff and stinking with pus and blood. Beneath the table was a sawdust box for collecting blood. The death rate was further heightened by the shock of the operation, and because operations took place as a last resort, patients tended to have few reserves of strength. Visit Ivona.com. Create and download recordings voiced by Ivona Voices.